The Newsday continues here on One News Now. I'm Sean Yao. Children aged 5 and above in areas under modified GCQ and normal GCQ or MGCQ and GCQ are now allowed outdoors. To give us his insights and weigh in on this matter, we have Octa Research Fellow Guido David joining us via Zoom. Good afternoon, Professor Guido. Was this a wise move, you think, on the part of the IATF considering the threat of the Delta variant?
Hi, Sean. Good afternoon. And I understand the concern. What we're seeing, or when we check the specifics of this move, what we're seeing is that they're only allowing children outdoors in open areas, not necessarily in malls. So it's in alfresco dining and in public open areas, what we're referring to now as safe spaces as we transition to the next normal. So in a way, we understand this because a lot of children have been locked up for more than a year now, and there is a considerable concern about the mental state of children. And I think being in outdoor places is not of significant risk at this time. Now, that may change, of course, if the Delta variant is known to be in community transmission in the country. But right now, we don't have that information yet. So I think this might be the time for them to be able to, at least experience some outdoor have some outdoor experiences.
Right, allowing children to go outside their homes could actually have more positive effects on their well-being. Now, all that having said, Guido, how can parents ensure that this new policy will not result in the spread of COVID variants among kids? Just say even without Delta.
Yeah, and that's a very important point, Sean. We are aware of that. Even without Delta, we know that the Alpha and the Beta variants, also called the UK and the South African variants, are transmissive for children as well. We know that because we see that in the data, that the number of cases in, for children below 17 has also increased. And that's why there's a slight concern. Of course, the mortality rate is lower for children, but still, if we have a 0.1% mortality rate, that means 1 out of 1,000 children will die, and that would be an unnecessary death, and that would be very sad. Of course, so we think that the parents will still have a big role in terms of the responsibility in whether or not they allow their children to go out. I mean, it doesn't mean that children are allowed to go out, doesn't mean that they have to go out. My initial understanding of this policy was that they would have to be accompanied by parents, especially vaccinated parents, because there was some discussion about safe spaces and open spaces for children with vaccinated parents or seniors. So I'm not sure if I saw that or if I read that in the guidelines, but definitely we don't want children to be going out on their own.
All right, we'll look out for that specific provision. Now, moving on to COVID numbers in Metro Manila. How is the capital region faring right now? Are the numbers better? And how is the situation in hospitals?
Right now, Sean, the National Capital Region is still, we are still grading it as yellow, meaning it's still in moderate or medium risk according to the COVID Act Now criteria developed in cooperation with the Harvard Health Institute and Bloomberg and Microsoft. So we actually had an uptick last week in the NCR, but now we had this 7% negative growth rate, which means now there's a decrease in cases again. We're averaging 636 cases per day. Positivity rate is still 6%. We're hoping it gets to 5% soon. Hospital utilization is very low now, less than 40%. So those are good numbers. The reproduction number has increased slightly, but it's still at 0.85. So it's not really an area of concern right now. That being said, people still need to follow protocols because we need to be able to bring the cases down even further now that we are vaccinating more and more people in the NCR. As I understand it, more than 20% of residents in the NCR have already had their first dose.
Right, and of course, most of the country's population also centered around urban areas. Now, well and good hearing that the NCR is doing better in terms of numbers and hospital utilization rates, but, I'm sure other areas in the country are seeing an uptick in COVID cases. Can we attribute this uptick to any specific strain or any specific reason? And of course, I have to ask, which areas are these, if they have changed in the past week?
Well, not a lot has changed in terms of the areas of concern. There has been an improvement in the trend in Davao City. They're now averaging just 240 cases per day, but there's still an area of concern. They're still marked amber because of the testing and the ICU utilization. So Davao City, Iloilo City, General Santos, Cagayan de Oro, Baguio City, Tagum. These are areas of concern and marked in amber. We don't have any evidence yet that a new strain or variant is spreading in the NCR, but based on the genome sequencing, what we're seeing is that it's still predominantly the alpha and the beta variants, 50% alpha, 50% beta, more or less. These are not variants to underestimate because they can still transmit to children. They're still 50% more infectious compared to the original strain, but they're not as dangerous or as a big threat as the Delta variant. And we're still keeping an eye out on if the Delta variant is able to enter into community transmission in the country. We hope not.
Yes, hoping right alongside you as usual. Thank you so much for your time and your insights and sharing your data with us, Professor Guido David of the Octo Research Group. Thank you. And in politics, PDP Laban has expelled Vice Chairman and Energy Secretary Alfonso Cusi, along with 2 other members from the ruling party. In a resolution dated July 3, the Pacquiao-led party declared the immediate and automatic expulsion of Cusi, as well as Deputy Secretary General Melvin Matibag and Membership Committee Head Astra Naik. The move stemmed from the 3 members' supposed violation of the party's bylaws and constitution. In a separate resolution, PDP Laban authorized Pacquiao to create investigation committees that will look into the violations. A separate PDP Laban decision, meanwhile, has declared null the March 31st and July 17th meetings led by Cusi and Matibag. The resolutions came after 10,000 PDP Laban members condemned the supposed systemic and underhanded effort of party newcomers and officers to sabotage Pacquiao's leadership. We'll be back with more stories after this quick break. Keep it here. still watching One News Now. I'm Sean Yao. A Senate committee has scrapped a bill seeking the lifetime validity of passports for senior citizens. Mean Los Baños joins us live from Rizal for more details. Mean, what were the reasons given by the senators on not wanting to grant senior citizens a lifetime passport?
Hi, Sean. Good afternoon. Senate lawmakers believe that the proposed measure on lifetime validity of passports for senior citizens may only do more harm than good for the passport holders. At the Senate hearing today, the Foreign Affairs Department explained that lifetime validity is not a recommended practice by the ICAO or International Civil Aviation Organization. Maria Gambol, Executive Director of the Office of Consular Affairs, said that the standard practice is that passports should be valid for not more than 10 years. This is to keep up with the possible changes in the physical appearance of the passport holder. The DFA said the Spanish government had tried the lifetime validity rule before, but resorted back to the 10-year validity for senior citizens. With this, Sean, Committee Chairman Coco Pimentel agreed not to push through with the passage of the bill. Meanwhile, Senator Amy Marcos asked the DFA to expand its courtesy lanes, especially for senior citizens, up for renewal. In response, Gamble said that they give considerations to seniors, but the pandemic has prompted them to limit the number of people entering consular offices. The DFA also explained during the hearing that their online appointment system for courtesy lanes may be full, but people can apply via the DFA email. Sean, through the system, senior citizens, persons with disabilities, and pregnant women are given priority. Sean?
All right, thank you so much for that update and stay safe. That was Mean Los Baños joining us live from Rizal. And PBA fans will not be allowed inside the Inares Sports Arena during the opening of the league's 46th season on July 16. Commissioner Willie Marshall said that the new season will be following a closed circuit setup. The league will also be adopting a 10-day cycle for COVID-19 testing. Once one player tests positive for COVID-19, the entire team will be isolated for 7 days. Marshall also said that 95% of the league's players and staff have already been vaccinated. Violators of COVID-19 protocols will be slapped with a 75,000 peso fine and 10 days of suspension without pay.
Positive, kailangan i-isolate natin yung buong team ng ilang araw. So hindi pa makakalaro yun. So makakalaro sila sa dulo na. I-isolate namin yung buong team. Kung may nakalabang pa siya, 2 teams namin i-isolate. Pero for 7 days. Titingnan namin, pag okay sila, itetest ulit sila. Pero yung positive, yun talaga, 14 days yun.
For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.